So good afternoon. Today we're going to give an update on some of the recent trends we've been seeing with the Commonwealth's COVID cases. But first, I just want to give a quick daily update. Yesterday, the Department of Public Health reported 1,216 new cases, 20,086 new individuals were tested by molecular tests, which means that over 2.6 million individuals have been tested in the Commonwealth and over 5.7 million molecular tests have been administered. And the 7-day average positivity rate remains at about 1.6%, which is where it's been for the past few days. There are about 550 individuals currently hospitalized either with COVID or suspected of COVID, and about 105 are in the ICU. Confirmed hospitalizations have grown over the past 2 weeks by a little under 20%. Confirmed cases over the past 2 weeks have grown by about 70%, which indicates that we are not currently yet seeing many new severe cases that require hospitalization. It also indicates that we're catching cases earlier and that more young people make up our case counts. As you can see from the existing chart here, the number of new cases has been increasing over the past several days, with the last 4 days clocking in at over 1,000 new cases per day. Numerically, we haven't seen cases this high since May, and as we continue to look at the data, several things become clear. Over the last several weeks, we've seen a significant increase in the number of people under 30 years old testing positive for COVID-19. That, by the way, is completely consistent with the conversations, discussions, and announcements we've put out about social gatherings, especially among younger people. In April, the under 30 crowd represented about 15% of the COVID-19 cases in Massachusetts. The over 60 crowd represented 42% of cases. Today, the under 30 crowd is now responsible for 37% of cases, and the over 60 crowd makes up only about 18% of cases. The share of positive cases between the under 30 crowd and the over 60 crowd has basically flipped. Today, fewer older people are getting sick, while the under 30 group make up a much bigger percentage of our positive tests than they did in April. There is a little good news in there. It means that our most vulnerable residents have seen a significant decrease in their share of new cases, which has much to do with many of the measures that we put in place over the spring and summer, and as a result are resulting in fewer infections so far. Long-term care facilities, as we all know, were hit hard early in the pandemic, and we created a variety of strict guidelines on ways to protect our most vulnerable residents from being exposed to COVID-19, especially in controlled environments like nursing homes. We and they are now far better equipped to keep the virus from spreading in these settings with adequate PPE, doing much more regular testing, infection control policies, regular audits, and managing visitation from the outside. We'll continue to take the precautions that are necessary to protect older adults from this virus in all settings as we go forward. The Command Center is also working to publish more data around clusters and where new cases are coming from, and that'll be available in this week's weekly report, which is Thursday. What's most concerning about this data is the spike in cases for people under the age of 30. According to our most recent data, about 300 people per day under 30 have contracted COVID-19, tested positive for it, with about 38,000 people in this age group diagnosed since March. Rising cases in this demographic has implications. First, our contact tracing initiative shows that over half the Commonwealth's new cases are attributed to social gatherings and household transmission. The science is quite clear that COVID spreads rapidly indoors, particularly in confined spaces when people aren't wearing face coverings or practicing social distancing. We've been clear for months now that unregulated social gatherings are largely prohibited because they are the perfect environment for COVID-19 to spread. Communities, local officials especially, continue to report that house parties and gatherings are happening now indoors as the weather cools and as people have let down their guard. People need to remember that COVID has and will be with us until there's a vaccine or new treatments. COVID is a very contagious virus, and it will rear its ugly head wherever it gets the chance. That means, although we're probably all pretty tired of it, we have to keep fighting it with the tools and the policies and the protocols that we know make positive difference in dealing with it. To keep case rates down and help us not only keep people healthy, but also ensure that our hospitals continue to have the capacity they need to serve their patients, our young people need to be serious about dealing with COVID. We get the fact that for many young people, they have mild symptoms or in some cases no symptoms at all. But their contact, especially close informal contact indoors over an extended period of time, like watching a football game on a weekend with older people or those who have other medical conditions, can create terrible circumstances for many of our most vulnerable. The silent spread of COVID in some ways is one of the most dangerous aspects of this disease, and it's why back in May we were one of the first states in the country to put an order in place to require people to wear masks in public if they couldn't socially distance. People really need to stop hosting big parties, and I say that as Halloween approaches. I said many times over the course of the past 10 days that organized and structured outdoor trick-or-treating is a much safer way for people to celebrate Halloween than to gather indoors for an extended period of time, to share food, to play games, and to participate in what I would describe as close contact activities between and among multiple generations. In addition to this, behavior at many youth sporting events, and we'll talk a little today about ice hockey in particular, needs to recognize and respect the virus. DPH oversaw the investigation of multiple positive cases that are linked to youth hockey. More than 30 clusters discovered more than 110 positive cases, another 22 probable cases, and more than 220 close contacts across 20 rinks all over the state. The cases impact at least 66 cities and towns. We also know that cases related to hockey and rinks are not isolated to Massachusetts. This is happening in other states as well. And it's likely these confirmed hockey cases led to dozens of additional cases as well. The data is real and probably undercounted due to the lack of cooperation by some of the adults who our contact tracing team reached out to, and to the fact that most teams wouldn't make rosters available so that we could follow up with the kids and the families on the team and not cooperating with case investigations generally. That's, among others, the reason why we took the immediate action and shut down all the rinks in Massachusetts for 2 weeks. Based on the evidence we have so far, it's not clear if the spread is about hockey or all the stuff going on around it. It's likely coming from all the activity around hockey and some irresponsible behavior from parents and coaches when it comes to COVID. The travel, the gathering before and after. Remember, many times these tournaments involve people showing up at a rink at 7 or 8 o'clock in the morning, playing a series of games over the course of the day, and basically spending more time at the rink with each other, engaged in conversation, sharing of food, potentially sharing of drink, and maybe only playing 2 or 3 games and then leaving at 6 or 7 o'clock at night. You can compound that by some of the ones that involve weekend trips to play in tournaments in nearby states, and you get the idea that it's about a lot more than just the time on the ice. Parents and coaches have an obligation to protect their kids and themselves and their teammates. I know the shutdown wasn't welcome news. Anybody who saw my social network page knows that. But youth hockey needs to make some changes, and we look forward to working with them to create the kind of framework that will be safe for kids and for parents. This is exactly why we can't afford to be careless when it comes to this insidious disease. Everybody needs to think about their priorities. Do we want to get together with friends, some of whom we may not have seen for a long time, in close quarters, and share food and drink and tell old stories and be inside? Or do we want to slow the spread of COVID to protect public health, keep the economy running, and keeping our families safe? People need to be responsible about this so that we can continue to keep our economy running, our schools open, and ensure that our hospital system has the appropriate capacity to treat all patients. Just as people have been doing their part by wearing a mask in public and practicing social distancing and following the guidelines where they work, people need to keep their guard up in their personal lives as well. Hosting parties and big indoor gatherings is just not a good idea and won't be a good idea until there's a treatment or a vaccine. I know that's hard news for everybody, but the simple truth of the matter is, in many cases, a lot of the information that we've gathered, and Mary Lou will talk a little more about this in a minute, makes clear that it is those informal settings and gatherings where the most significant issues associated with no masks, no social distancing, none of the things we've been talking about to keep people safe are simply not are a major part of the way those events go off. I can appreciate this is especially difficult for young people, especially those who in many cases have been working from home and simply don't have the same chance to socialize with their friends that they once did. But we've worked hard to open up most of our economy, and we urge people to pursue what we would describe as supervised and organized and safe events when they think about their social network, and try to stay away from the stuff that clearly at this point has a lot to do with what's driving the virus. We're asking everybody to really stop and think about this. Think about your loved ones. Think about your parents, your grandparents, your aunts, your uncles, all those people who can get very ill and hospitalized if they get this virus. Think about all those healthcare workers and first responders who've been working tirelessly on this issue since last spring and don't get a day off in many cases to take care of the sick, putting their own health and concern for their families on the line for us every single day since March. Think about all those school-age kids that really need to stay in school so that they can learn, play, and develop their very best self. Unlike the spring, folks have a lot of options now to safely do a number of activities that have been proven to be safer alternatives. As we head into this holiday season, as we move indoors, as our cases, as we said almost 3 weeks ago, have continued to climb, use your head and think about how your actions will affect those around you. Now, speaking of social gatherings, I thought I might spend a minute talking about Thanksgiving. I think we all know the last 9 months have been tough on everybody. And the holidays are usually a time when we all get together to celebrate the spirit of the season. But there's just no way around it. The holidays have to look and feel different this year if we're going to keep up the fight against COVID. I know that's hard to say, and in some respects it will be even harder to do. But the science on this one's pretty clear. Gathering in groups, indoors, for an extended period of time with family and friends is likely the worst possible scenario for spreading the virus. Today, the Department of Public Health has released tips on how families should think about and plan for a safe Thanksgiving. The lowest risk for spreading COVID-19 is to celebrate with only members of your household or to host a virtual gathering with other members of your family that can't be there. This is the best way to avoid bringing this terrible virus to your parents, your grandparents, or other loved ones. If folks do decide to gather with family members outside their household, the Department of Public Health recommends limiting guests as much as possible and to keep it to your limited social network, those that you've seen on a pretty regular basis. The scenario is certainly considered high risk for transmitting COVID, and Thanksgiving requires folks to eat indoors, to drink and to socialize over an extended period of time and maybe watch a football game or two. Secretary Sutters will provide more detail on the DPH guidance in a moment. But every family here in the Commonwealth needs to think long and hard about the well-being of your loved ones before you make your plans. If you have a loved one who's at high risk for COVID, it's simply a bad idea to risk exposing them. And as I said before, this virus, especially for people in those kinds of categories, has no mercy. COVID won't take a vacation. It certainly won't respect the holiday, and we need to respect that when we make decisions about how we plan to spend that weekend. It's important that we continue to work to stay a few steps ahead of it and carefully consider our options and our plans before the holidays. For more details on DPH's Thanksgiving tips, please visit mass.gov/DPH. The Commonwealth, the country, the world have been battling COVID-19 for the better part of a year. And we'll be in this fight, as I've said many times, until there's a treatment or a vaccine. While the virus has stayed with us, much has changed, and today we know far more about it than we did last spring. We have more resources like PPE, testing and tracing capacity. We've created a framework of guidance to safely keep our economy and our schools going. We're well prepared to take the fight to the virus wherever we can. But if people let their guard down and they don't do their part, all that preparation and all that sacrifice that we've made to bring our numbers down won't be sustained. We can all do our part to stop the spread. It's the simple things that we have to repeat over and over that are the best weapon we have to slow the spread of COVID. Wherever you are, wherever you're with, you should wear a face covering, social distance, practice good hygiene, stay home if you're sick, get a test if you think you've been exposed, and don't host or attend gatherings with people who aren't part of your core network. I can't emphasize this one enough. And as a state, we'll continue to bring every resource we can to bear, but it's critically important, especially during this time of year, that everybody think real hard about the decisions they have to make and consider those around them and themselves and the role and the importance of this virus in those decisions. I want to turn over to Secretary Sutters to talk a little more about a number of examples that fit right into the category of what we refer to as being too familiar with familiar people in familiar settings and why that creates so much trouble for us in trying to manage this virus. Thank you.
Governor, Lieutenant Governor, good afternoon, everyone. Let me start with the holidays. As you heard from the governor, November and December are months of significant holiday gatherings, from Thanksgiving to Hanukkah to Christmas. It's a time when family and friends come together. We know Thanksgiving is top of mind once we get by Halloween. Being with one another is something that many of us need and want more than ever, of course. But we must remain vigilant and incorporate COVID safety precautions into everything we do, including holiday celebrations. There's just no way around it. The holidays need to look and feel very different this year. It's hard to say, and I'm sure even harder to do because traditions run deep. But the science is clear. Gathering in groups, packed inside, with friends and family coming and going, is likely the worst possible scenario for spreading the virus. Today, the Department of Public Health has released safety tips on how families can plan for Thanksgiving and keep their families safe and risk low. No one wants to spread the virus to parents, aunts and uncles, grandparents, loved ones, or individuals with underlying medical conditions. As the governor said, the lowest risk for spreading COVID-19 is to celebrate with only members of your immediate household or to host a virtual gathering. We're all getting used to Zoom things these days, so you could actually Zoom Thanksgiving with your family and friends across the country. If people do decide to gather with family members outside their household, the Department of Public Health recommends limiting guests as much as possible, keep it small to a very limited social network. Understand what your guests do to keep themselves safe before you invite them. Define your bubble. This scenario is certainly considered high risk for transmitting COVID, as Thanksgiving requires people to gather indoors to eat, drink, and socialize over an extended period of time. If people choose to go this route, it's critically important that everyone observes some of the following tips. Wear a mask inside when you are not eating or drinking. Keep your gathering size small. Have I said that enough? Keep your gathering size small and make sure you abide by the Commonwealth's gathering limits. Keep the holiday shorter this time, on a shorter time frame to minimize time together. Open doors and windows to allow ventilation. Spend some time outside. Wear a mask while preparing food and don't share food or utensils. Limit your exposure to others several days after the holiday and get a COVID test. Every family should think long and hard about the well-being of your loved ones before making your holiday plans. If you have a loved one who's at high risk for COVID, an underlying medical condition, it's not a good idea to risk their health for a one-day celebration. COVID doesn't take vacations or respect holidays. In fact, it loves to be the uninvited guest. So it's important that we stay a few steps ahead and make the appropriate plans. And as you heard from the governor, for more details on DPH's Thanksgiving tips, please visit mass.gov, and we're working with a number of our testing sites to increase the number of hours a few days before the holidays. On reporting. Yesterday, we reported 1,216 newly positive cases. Of those, here's what we know. 25 are associated with long-term care. 25 are associated with higher ed testing. 34 are linked to places of worship. Another 36 are associated with known clusters, including social clubs. An additional 538 are associated with 19 of our highest risk communities, from Boston to Framingham. 558 are not linked at this time. They're newly identified cases to either a known cluster, long-term care, higher ed, places of worship, or other identified settings. Contact tracers, of course, are in touch with these individuals to understand what their needs are and how they might have contracted the virus. We continue to see newly positive cases in two particular settings, in addition to other ones we have talked about before. And those include social clubs, including most recently the Elks Club and Pleasant Park Yacht Club in Winthrop, Massachusetts, and places of worship, including the Crossroads Church in Fitchburg, which was recently sanctioned by the state. Not for having church services, but for opening up their house of worship for retreats and the like, in violation of the state's guidances. It is very important that social clubs, private clubs, and houses of worship maintain the Commonwealth's guidances. You will see that more as we roll out the cluster information this week. Finally, as you've heard from the governor before, we will be revising the public dashboard next week, the first update in quite a while. It will include more information regarding identified clusters. We will preview some of the cluster information in this week's weekly report on Thursday. Governor?
Questions?
Second surge. Are we seeing the beginning of a second surge in Massachusetts?
Yeah, we said that we were going to see increases in case numbers in the fall, and we are. And it's not just true here, it's true around the rest of the country, and it's true in many places around the world. And as I said in my remarks, we have far better information than we had available last spring to understand where those clusters are coming from and where our new cases are coming from, which is why we think the reporting on community-based stuff, as well as some of the cluster work that will start showing up in our weekly report, will be really helpful to people. The other thing I have to point out, because it's critical to this whole conversation, is the changing nature of who's actually showing up as positive cases. It's a very different demographic than what we saw last spring. And it speaks in many ways to this whole issue of young people and social gatherings and some of the issues associated with the fact that young people typically don't get as sick. Some do, but many of them don't get as sick as older people do, and that makes them, in many cases, much less aware of the fact that they have the virus and that they can give it to others, which is why, on some level, I'm glad to see that there's a significant increase and a focus on testing among that particular community, because identifying cases early, especially those who don't get that sick and may not know they're carriers, will hopefully be a lot smarter about the way they handle it once they discover they've tested positive.
But it's been reported the state doesn't know or hasn't been able to determine the source of infection for about half of COVID cases. How concerning is that, and how do you figure out how to respond if half of them don't know the source of it?
It's not that we don't know the source. They're not affiliated with a particular cluster, which is a different issue. And the other thing I would say on this, because it's important, as this thing moves into this population here, you know, there's a lot of evidence that this population just doesn't get as sick as this population does. Some of them will, and it will be a horror show for them, okay? Let's not forget that. But for many of these folks, they don't get that sick. They just carry it around and give it to others, which makes some of the issues associated with contact tracing a little more complicated. I mean, here, right, when these folks get sick, it's much easier to contact trace with them because in many cases they have symptoms that can be applied back to other people who had symptoms who showed up in the DPH data. So one of the reasons why some of this contact tracing lags a bit is because DPH needs to actually see the people land in that Maven file after they get tested and then track it back to the same places or institutions that some of these other people came from. The churches and the social clubs being the best example of that.
Governor, we've been hearing about gatherings. You've been talking about gatherings for months and months and months.
Well, I'm glad you've been paying attention.
Well, I
That
have
makes
been.
me feel much better.
But
Yeah.
nowadays, we're hearing about a new party or a new gathering shutting down a school or something else all the time. We're
Yeah.
hearing about it all the time. The people in their 30s, it sounds like they're just not listening to you.
I don't think it's that people aren't listening because they're getting tested, okay? I mean, part of what I take from this is a lot of people, they are definitely having these gatherings. That's happening, okay? But they're also getting tested. And remember, they were really not a big part of our tested community back here. I do think they're testing more because they are gathering and they're at least getting the message that if you're going to an event with a bunch of people who you don't know, it's probably a good idea to get tested afterwards. But I think what we would say is it's probably better just not to do the event in the first place and to recognize and understand that if you're going to be in some place like that, you really need to wear one of these. And I get the fact that when you get into the informal world, that's awkward and a little complicated. But there are plenty of people who do it all the time. When I go see my dad, I schedule an appointment and I meet with him according to the schedule that's been developed by the place that he lives, and he and I wear a mask and we sit at least 6 feet apart from one another and we chit chat and all the rest. I don't give him a hug. I don't do any of the things. We don't share a meal. We don't do any of the things we used to do when we got together. But that's because I get the fact that even in a situation like that, it's critically important for people to respect the contagious nature of this virus.
Governor, your experts had indicated that we were going to see a surge, which you predicted, you talked about, you warned people. Is it going to get worse?
I think what happens with this virus actually in many respects depends a lot on how we as a Commonwealth choose to respond to it. I mean, if people gather inside and have a whole bunch of indoor Halloween parties, which I think everybody's heard pretty clearly from us and from many others that that's just a bad idea for a whole bunch of reasons, that will hurt with respect to our numbers and to the spread. If people don't take our advice with respect to Thanksgiving, and they do the sort of thing that everybody, I mean, Thanksgiving at our house last year was 18 people crowded around a table that probably fit comfortably about 12, followed by, naps on the couch and football games that no one watched, and then, sandwiches and conversation. I mean, it was a long day with a whole bunch of people, all under one roof. We did go for a walk. But the bottom line is that is what Thanksgiving is for most of us here in Massachusetts and has been for as long as we can remember. The other thing that some do is they go to the high school football game. There won't be one of those this year, so at least that won't happen. But I can't tell you how important the individual decisions that we all make are going to be with respect to how this goes forward.
Can you contrast what it will look like this year in your home, just so other families can, that's what
It's going to be immediate family, and that's it. It's not going to be my dad. It's not going to be any of our neighbors. I mean, it's going to be a much different event.
Governor, all through this, you've expressed faith that people will follow the guidance that gets offered. It is just guidance. It's not mandatory. This, that, or the other thing.
Well, some of it, I mean, if you don't do some of it, I mean, ABCC
Right, but
will inspect you and fine you.
homes
Yeah.
and things like that. That's guidance you're asking. Given what you described with the parties and the sporting events, has your faith in what people will do the right thing, has it been shaken?
I think my faith in people has not been shaken. What I would say is that I get the fact that this has been going on for a long time, okay? And I get the fact that people are hungry for the kind of physical presence that is such a fundamental part of the way we live. But what I would say in response to that is there are really important things that depend on us continuing or getting back to respecting the virus, wearing a mask, not doing the group stuff, and all the rest that have to do with things like people's ability to work. All right, right now, work for the most part is pretty well monitored, pretty well investigated, and while there are isolated incidents that show up that relate to work, it does not show up as the big driver. People need to work. I mean, everybody in this room here, and this may sound a little rough and I apologize, are going to get paid whether we shut down the economy or not because of COVID. It's very important to me that we respect the people who are maniacally trying to do the right thing with work, whether they're the line worker or the supervisor or the manager or the owner. That we make it possible for, if they are doing the right things and they are only on an isolated incident basis, part of our problem with respect to COVID, we need to let them work. But to let them work, a whole bunch of other people have got to be willing in their downtime to avoid the things we've been talking about that drive spread. And Steve, I think Massachusetts has one of the highest face covering, wearing a face covering rates in public spaces you're going to find anywhere in the country based on every survey that's been done. But it's not those circumstances where we have issues. It's the others, the informal ones where the social clubs or the churches. I mean, I'm a huge believer in faith. You know how much I hated shutting down religious gatherings when this all began. But people have to, even in those settings, people have to respect the fact that the virus will travel if you let it. And, you know, there's so much evidence out there at this point that this thing cuts the virus's ability to move, especially if both people are wearing it, by like 90%. And the other thing that Dr. Roberts from North Shore Medical said when we were up in Salem, basically taking all the fun out of Halloween with Mayor Driscoll, was not only does it reduce, do two people wearing a mask reduce the likelihood of transmission by 90%, the other thing he said, which was a really important point, was it also dramatically reduces whatever droplets or virus would get spread at all between two people, which means if there is the potential for some spread, it will be much less aggressive on the person on the receiving end of that than it would be otherwise.
Governor,
This is public safety.
Sorry, you've been adamant about kids should be in school. Milton High School today was the latest to go full remote. We see on the graph that teenagers are in that group where the infection rates are rising. Would you agree that these towns moving into the red and perhaps having problems with parties or infection rates should be shutting down at this point?
Well, let's start with Marblehead. What Marblehead did was basically said, we're going to go remote. for 2 weeks because we don't know who was at that party. And we can't trace it, and we can't quarantine. I understand that point of view. But I also think about Swampscott, which is where I live. Swampscott is considered to be a high-risk community right now. But they went from remote to hybrid this week because there is very little evidence that this virus spreads in schools. And in fact, we have one of the best active demonstrations about in-person learning going on anywhere right now, which is the parochial schools. The parochial schools have been in person since mid-August, and they are located for the most part almost completely in high-risk communities. And they serve primarily people of color. They have almost 30,000 kids, 4,000 teachers and staff, fully in person since August in places like Lynn and Revere, Brockton, Boston. They have less than 25 COVID cases, and they all came from outside in. I would argue that the structure and the rules and the guidance that we developed with the public health folks and the pediatric community and made available to our public schools back in July, that guidance would make it possible for kids to go to school. And I can make an argument that at least at this point, it's a jump ball in my mind about whether having all those kids at home fraternizing with their friends, not wearing a mask, not socially distancing, on the off hours, is probably every bit as risky, maybe more so, based on what's going on with the parochial schools, than those kids being in school, wearing a mask, and having the rhythm and the structure that comes with spend 6 or 7 hours a day in a formal setting where everybody's got a face covering on.
Now Milton, where I live, they said they found some cases at the high school. Again, it could have come from outside. Who knows?
Yeah.
It's spread at school. Do you think Milton could be making a mistake then in this case?
I've never wanted to, and I've said this before, I never want to, Monday morning quarterback a community where I really don't know the facts. I mean, what we have said to people, and we continue to believe it's true, is that people need to look at several weeks worth of data, and that people ought to be willing to make adjustments based on what the data says. And the data, not just here in Massachusetts, I mean, we have 120 cases, and we have roughly 450,000 kids in school. Talking kids who are either in hybrid or in person, not remote. That number, that's staff and kids. That number is like this big relative to the number of kids who are and staff who are in schools on a weekly basis, one way or the other. So from my point of view, I think people ought to take the guidance that we have out there and apply it, which is if you have 3 weeks in a row, 4 reporting periods where you're red, you should start thinking about, and if you're operating either in person or hybrid, you should think about what you want to do at that point. If you don't have any transmission in your schools, it's probably fine to continue to have kids go to school, because we now have data not only in Massachusetts, either on the public side or the parochial side, but we have data all over the world now that basically says structured learning in school in person is not a spreader. It's just not.
Contact tracing.
Yeah.
It's consistently been green on the dashboard, but after all those layoffs in June, did we snap back up? Did we have capacity?
Yeah, the answer to that is, you should speak to it, but the answer is yes, we did. A lot of those folks left with the idea that they would and could be called back, and they did. Do you want to speak to it, Mary Lou?
So, as you know, when the cases decreased, we we reduced the number of individuals on the contact tracing team. And in part, as we started to have the contact tracing team be involved with higher ed, we started to flex back up. And so for the past, I'm actually pulling out the data. We have 661 on the CTC side at this point and have 4 classes that have been coming in since September. So we have classes every week of about 35 to 50 a week of new contact tracers coming in. And we will continue to flex up as we need, with the goal of having about 1 contact tracer for 20 people. And right now it's in the high 20s.
Secretary Sutters,
How many folks doing this work at the local level?
Yeah, so the total number is just under 2,000. So we have about, I want to say it's 1,851 or it's 1,951 individuals who are doing contact tracing across the Commonwealth of Massachusetts. But we will continue to add classes as we see the cases coming in on a daily basis from local boards of health.
Secretary Sutters, a follow-up question to your Thanksgiving guidance for in-person, people who are going to do the in-person family gatherings that are small.
So much for listening to me.
You said don't share utensils or food.
Yeah.
So I'm wondering, how does that work?
So, what we're really trying to say is don't share your plates. I don't know. So not to be too, right, I don't know if you ever carved a turkey. So I'm thinking of Thanksgivings I've had with friends and people are standing in the kitchen, maybe with an adult beverage in your hand or a glass of cider, and you're carving up the turkey, and people are like taking pieces, right, of skin or like the little nibbles on the side of the plate because your slice isn't perfect. Like, you shouldn't do that. And really the perfect way to do this is, it'll sound a little formal perhaps, is literally 1 or 2 people in the kitchen with face coverings on, right, doing like sort of creating plates for people and then literally serving people at the table. So you're not even taking bowls and plates and sort of sharing them around. That it's almost like, wait service at your table. I guess the good news is if you're sitting at the table, you're going to be served, and 2 people are in the kitchen or somebody's in the kitchen who's actually sort of plating and taking the meal to you. That's really like the perfect way, or I don't know, perfect, that is a good way to do it. There's no perfect in a time of pandemic, but it's really like rethinking, not like taking, I don't know. There have been times where I'm sure I've seen something on my spouse's plate that looked better than what was on my plate, and I took my fork and did that. You just have to be really conscious about like the sharing of utensils, the sharing of plates, and certainly like not picking at the turkey carcass this year.
And any guidance for college students who may travel home for Thanksgiving? Would you like to not see that happen?
Again, every family is going to be making their own decisions about this. Certainly, you don't want to see a college student sort of, alone in their dorm without any family connection. So if students are coming home, we have travel restrictions. So if they're in a state and coming home, they need to understand whether they need to, if they come home without getting a test before they come home, they need to quarantine with their family for 14 days or get tested upon when they come home. So, the travel restrictions apply. So if you're coming from, pick a state outside of our travel restriction states, people need to comply with those travel restrictions, which is also up on the website, making clear that you comply with the guidances.
Has there been a reluctance on some groups and organizations to cooperate with the contact tracers? I thought I detected that in the governor's comments.
So, can I take let me take the ice hockey. So one of the reasons of the 2-week pause, aside from I think you heard the numbers from the governor, right, 66 municipalities, several hundred individuals, 20 rinks, was in the process of doing the investigation. So these are the 13 epidemiologists that the Department of Public Health is sort of directing their cluster investigation work. There were a number of instances where the team would not hand over the rosters of students, of players, I'm not in school, of players, so you didn't even know who was playing for us to make the contact, or coaches in a couple of instances telling families and the players to not respond to the contact tracers. So we felt that was not sharing the rosters so that you can't make the phone calls is for us not it's not acceptable. And in a couple of other circumstances, there were teams who indicated that quarantine meant that you couldn't play on that team, but you go play on someone else's team. And that's obviously not quarantine. So in the strengthened guidances that will come out, we're going to be very clear about sharing of rosters and attestation to that effect, as well as transportation to the rinks and the like.
Is there anything the state can do to mandate that information coming in?
I'm sorry.
Is there anything that the state can do to mandate that information?
Yes,
get out?
this will be the updated guidances, and with the expectation that if there's not cooperation, then we would close down the rink or the team.
Could I ask you if the Department of Health has any information about whether we are closer to
Which Department of Health are we talking about?
Massachusetts?
Department of Public Health, as opposed to mental health?
Yes, yes. Whether we're closer to an antibody test. There's 150,000 people who've had it. There might be 100,000 more people who've had it and don't know. Is there anything coming on it?
No. We're really focused, as you know, on trying to maximize and make available the PCR testing and make it as user-friendly as possible. And we are actually this week, and I think we had said this probably a week or two ago, we do have some of the Abbott Binex, which is the point-of-care antigen test, and we're actually testing its sensitivity this week up in Lawrence. So individuals who are at one of the Lawrence testing our free testing sites, they're having a PCR test and the point-of-care test to determine the sensitivity, because if it has the sensitivity that we hope it has, we will be getting that out and about. And that's literally, it's a point-of-care test, 15 minutes and you have the results. And we think that will be a good way to have people identified if they test positive and the like.
Governor, you talked a little bit about people needing to work. And I think most people understand you're not looking to shut down the state's economy. But with cases surging nationally as well as in the state, how bad does it have to get if people don't listen and cases continue to rise?
Well, I think what you're going to see us seek to do is to take advantage of the data and the information that we have now that we didn't have last spring, and pursue what I would describe as targeted interventions. The hockey thing is a good example of that. I think the ABCC, which has been a tremendous partner in investigative activities, especially around restaurants and pseudo nightclubs and places like that, is probably going to spend a lot more time in social clubs than they've spent recently. I think you'll continue to see us do outreach to a lot of folks in the faith community, which we've been doing, which has been successful in many cases. And a lot of the work that's being done by the CEIT program, which is for the highest risk communities, identified by the testing apparatus that we have in place, has been targeted interventions in those communities. One of the reasons why we started to use this multiple language mass alert trigger on people's phones is one of the messages we got from a lot of the folks at the local level was that we needed to do something that would, grab people in their communities and point out to them that they do have a high case count and that they need to take precautions and act accordingly. And I think our view is we have better data, we have more resources, we're testing like crazy, catching a lot of people before we would have before, and we should really deploy these resources and then count on people to actually listen to what we're saying about where our problems are and to deal with that. And I do think these two big holidays are going to be really important with respect to that.
You don't envision like people thinking, with the holidays coming up and the surge is happening, you don't envision a situation like going back to what we had in March, basically, March, April.
Well, March, April was, very little testing and no data. I mean, we really didn't have much. I mean, the way I think about it is, we now have an instrument panel that gives us a lot of information about where we can make an impact and where our colleagues in local government and local public health boards and people generally can make an impact, and it's our hope and our expectation that people will do that.
Are you seeing any clusters or spread connected to work?
Some, but again, it's isolated, and it'll be in the report when it comes out on Thursday.
Governor, we're a week away from the election. Do you mind sharing sort of how you're thinking about voting and who you're supporting?
Well, I said this morning, the Lieutenant Governor and I both said we were going to vote no on ranked choice. We think it's very complicated, and we're about to have a very complicated election administratively just without it, all right? I mean, I think everybody's talked about the fact that it could be several days before this election process is over after Election Day. And I think from our point of view, this thing is just too complicated to add on top of that. The counting process alone could get unbelievably difficult. And I have all the faith in the world in the local communities and the people in Massachusetts and the rules and the protocols that we have in place here in the Commonwealth to have what, I would call a full and fair election. I don't want to overly complicate that process to such an extent that people start to wonder, what is it that's actually going on here? So I'm going to vote no on that, and so is the Lieutenant Governor. I said before that I was going to support Kevin O'Connor, and I'm going to vote for him for reasons I've discussed previously. I've also said I'm not going to vote for the president, and I've also said that before.
Do you think the election will be a turning point for this pandemic? A lot of people have their eye on the election. Maybe we'll see a brighter side on the other side of it?
Geez, I hope so. I think I said previously during one of these press events that one of the reasons turnout was so high in the primary was because people believe there's a lot at stake in this election, okay? And when people think there's a lot at stake, that tends to create a lot of emotion. And I think and there's been a lot that's happened. I mean, the pandemic all by itself would create anxiety, and it has, all right? You throw on top of that a whole series of really awful, terrible tragedies involving law enforcement and people of color. And then you throw on top of all that a presidential election and a whole series of elections and a Supreme Court nomination and vote. And with people really worried about all kinds of things associated with the decisions that will be made by their government at every level. And I think, it all points toward November 3rd. And as I said before, I think a lot of us who've been in elected life are going to do everything we can to make sure that whatever happens on Election Day, the people will have spoken and that the people's will needs to be pursued. And win or lose, I say that. And I'm certainly going to try and be one of those people who speaks to that. But I do hope that, once the dust settles, the dust will settle. We're still going to have to deal with COVID. We're still going to have to deal with the holidays. We're still going to have to deal with Thanksgiving and Christmas and all the other issues we talked about, and Hanukkah. But I think I do think a lot of people are pretty focused on November 3rd.
Would you support a vote by mail system beyond this year? Would you support a vote by mail system beyond this